hypolipidemics. As the name tells you, hypo means they reduce, lipidemic means they reduce blood lipid levels. That is why these drugs are given in the treatment of dyslipidemia. Now, dyslipidemia means when there is abnormal, dys means abnormal, increase in blood lipid levels. Now, to understand it in a more simple way, remember we have two types of bad lipids. The first is cholesterol. Remember, cholesterol is a cyclical lipid. It has cyclical rings. And another lipid is triglyceride. Triglyceride is a straight chain lipid. Now, these two lipids, when increased in the body, remember they are very bad for us. If cholesterol levels are increased, cholesterol deposits below the blood vessels, below the endothelial cells of blood vessel, which leads to narrowing of blood vessels. This is known as atherosclerosis. So, increase in cholesterol level leads to atherosclerosis, narrowing of blood vessel. So, if coronary artery becomes narrow, blood supply to the heart is reduced, it can lead to MI, myocardial infarction. And if this atherosclerosis occurs in cerebral arteries in brain, it can lead to stroke. And in fact, at today's time, the most common cause of MI and stroke is atherosclerosis. Now, if cholesterol is increased, we know what happens. Can you think and decide if triglyceride levels are increased, why it is bad for us? Remember, if triglyceride levels are increased, they damage pancreas. So, hypertriglyceridemia leads to acute pancreatitis. So, don't you think that is why cholesterol and triglyceride must be reduced in the blood? That is why hypolipidemic drugs are given in the treatment of MI, stroke and acute pancreatitis. Now, before starting with the drugs, now let's learn this in a more interactive way. Just imagine you have eaten a cheese burst pizza which contains lot of triglyceride and cholesterol. They will come to your stomach like cholesterol and triglyceride. From stomach and intestine, they will enter into lymph. And in lymph, we discussed these lipids, they are transported with the help of chylomicrons. So, chylomicrons, they will transport these lipids through lymph, and through lymph, all chylomicron will go to the liver. Now, liver into the blood will secrete VLDL, very low density lipoprotein. Now, this VLDL will be converted into IDL and LDL with the help of lipoprotein lipase enzyme, which converts VLDL into IDL and then LDL, because lipoprotein lipase removes triglyceride. Now, if our body cells require cholesterol, they contain LDL receptors, and LDL receptors donate cholesterol to the body cells. Now, these are bad lipids. Hence, we have a good lipid also, HDL, high density lipoprotein. It removes this cholesterol from the body cells. Hence, it reduces the risk of atherosclerosis. Now, this HDL, with the help of CETP, cholesterol ester transfer protein, transfers this cholesterol to LDL, and this LDL is taken up or removed by the liver.